When Vesuvius buried Pompeii in 79 AD, it also buried a surgeon's tool case on the Via dell'Abbondanza. In the 1800s, people dug up the case. The instruments are in Naples now. You can go see them. And what gets you is not how strange they look, it's how well you know it. A scalpel has a handle that is made for the same two-finger grip that a modern surgeon uses, retractors, forceps, needles for suturing, a lever made of bone, and a trepan, which is a rotary drill that cuts holes in the skull. Most people stop and catch their breath at the trepan. These are not basic copies of surgical tools. They are tools used in surgery. The Roman doctor who owned them knew exactly what he was doing. What will stick with you is everything he did without. That's right. And believe it or not, we're talking about without anesthesia in the modern sense. No clean area, no transfusions of blood. And once it started, there was no turning back. An unfinished surgery in 100 AD had a high death rate, so finishing quickly was the only option. There were more than 40 tools in the Pompeii case. The categories are only important because they show you what Roman surgery could really do. There are different shapes of scalpel blades, straight for straight cuts, curved for tight spaces, and pointed for cutting things you didn't want to cut by accident. The handles were made so that you could control the depth without having to apply pressure. Someone came up with this. In Rome, without biomechanics as a field, retractors are tools that hold tissue back while the surgeon works underneath. You are working in anatomical layers if you have retractors. You are not just cutting, you are dissecting. That isn't basic surgery. That is an operation. And the trepan, a rotary drill for the skull that cuts through the outer layers of bone and stops before getting to the inner layer. This is because the inner layer protects the brain, and you don't want to break it. No way. Roman doctors knew this. We know they knew it because we have their skulls. Archaeological collections all over Europe have skulls with trepanation marks, which show where the surgeon cut to a certain depth and then stopped. Some show that bone is growing back around the site. Bone regrowth means that the patient lived long enough after the surgery for healing to start. Let's be honest, sometimes patients lived. This means that the procedure worked sometimes. This sentence should make you think twice about everything you thought you knew about Roman medicine before you clicked on this video. There was nothing in the case for abdominal surgery either. That absence was a choice. Roman surgeons knew which surgeries were safe and which ones weren't, so they made their tools accordingly. They knew what they could and couldn't do. They were better than what the history books say they were within those limits. The instruments did not decide where those limits were. It was what they had to ease their pain. 3 people, none of them were anesthesia that put you completely to sleep. What they did made the patient feel less pain and, in some cases, made it harder for them to fight back. That is not the same as modern anesthesia. It is also a lot better than nothing. First, mandragora. Scopolamine is a real chemical found in the mandrake root that makes people sleepy, confused, and forgetful. The patient who took mandragora before surgery was not unconscious and did not feel no pain. But they were drugged, confused, and probably won't remember much of what happened after that. The part about amnesia is not nothing. A drug that dulls memory formation but doesn't affect pain perception was doing something that really helped. Not enough. But there is something, made as a wine infusion and given before the procedure, with a dose-to-death margin that Roman surgeons learned through experience and almost certainly got wrong sometimes. Second came wine. At high enough doses, alcohol makes pain and anxiety less noticeable. It also makes it harder for the body to handle surgical stress, blood clotting, and heart function. The surgeon who got the patient drunk before surgery was making one problem worse by making several others. Celsus, the most important Roman writer on surgery, says that wine is good in some situations but bad in others. The suggestion is not universal. It depends on the situation. This is the old way of saying, see your doctor before using. Third, opium. People grew the opium poppy, or Papaver somniferum, in the past, and it really did help with pain. Before and during procedures, Roman doctors used oral opium preparations, not standardized for concentration, slower to take effect than modern intravenous morphine, and absorption is less predictable. But really pain relieving, really making pain go away, not enough. But it's real. Rome's best medical answer to the problem of operating on a conscious patient was to use all three: mandragora for sedation and amnesia, wine for anxiety, and opium for pain relief. It wasn't enough to get rid of the pain. Roman surgery came up with a fourth method that didn't use drugs at all. Surgeons in Rome were quick, on purpose, in a planned way, and with training for speed, not because they were in a hurry or careless. They knew that speed was a key factor in whether or not a patient would survive. A patient who is in pain and aware of it will move. If a patient moves at the wrong time during a vascular procedure, they die on the table. The answer, since you can't use drugs to make the patient still, is to finish before the pain response has time to turn into coordinated movement. Celsus says that speed in surgery is a good thing. The best surgeon can use both hands equally well. This saves time by not having to move instruments around awkwardly, and they finish procedures as quickly as possible while still being accurate. Intention, speed, and accuracy are important. But speed is more important for survival. The lithotomy, which is the surgical removal of bladder stones, is where we have the most clear evidence of Roman speed. It took less than 5 minutes for a skilled Roman surgeon to do it, from the first cut to the last stitch, on a patient who was fully awake and being held still by helpers. In the 1800s, before modern anesthesia, it took surgeons 15 to 20 minutes to do this procedure. Now, it takes less than 5 minutes. There is a real gap. It is because of special training that focuses on working quickly, and it kept people alive. But this is the part I didn't expect to find. And this is the part that made me think differently about what Roman surgeons were really doing. They thought of pain during surgery as something they could control, not an impediment to remove, as they lacked a framework for envisioning surgery devoid of pain, but information. Celsus characterizes the patient's pain response as diagnostic. A change in the type of pain during an incision, such as from sharp to dull or from localized to diffuse, showed that the instrument had moved from one layer of tissue to another. The surgeon knew he was in the right place anatomically by how the patient reacted to certain movements. The conscious patient was, in the Roman surgical framework, an active participant in the procedure, not one who wants to, not a nice one, but one that gives you information. Modern surgery got rid of that source of information and replaced it with much better ones, like physiological monitoring, measuring the depth of anesthesia, and the ability to stop and start again. It was worth it to replace it. But the Roman system, even though it looks strange from the outside, made sense within its own limits. It figured out how to deal with what couldn't be changed instead of acting like it wasn't there. The Roman doctor couldn't stop the pain, so he turned the pain into something useful. In a small and specific way, that is one of the most impressive intellectual achievements in the history of medicine. Not because it was right in the end, because it was the right answer to the wrong problem, carefully thought out and used by people who were pushing the limits of what was possible. The Pompeii instruments are in Naples. You can see them, and they will look like something you know. And then you will remember what they were used for and how they were used. And they will look different. That is the right answer. The instruments are located in Naples. There are skulls with trepanation scars in museums all over Europe, and the bone regrowth around those cuts makes it clear that some of those patients went home. This is what this channel is all about. It finds the version of the story in which the Roman surgeon worked without what we would consider the bare minimum for surgery, and built a framework that was advanced enough that some patients lived. If you like this kind of story, sign up. One click gets you a free video, and the next one will come when it's ready. It will be about another Roman topic, maybe one that the official record didn't want to look at too closely. The Roman surgeon knew that when the patient is awake and the clock is running, fast and accurate beats slow and careful. It only takes a second to hit the subscribe button. You already know how to do the math.